Many people know of a story of this one time when a mother convinced physicians to remove her child's salivary glands because they believe she has sialorrhea, meaning an excessive amount of salivation. When the truth of the matter is, the mother had been putting in a topical oral anesthetic, something that numbed inside the child's mouth to make her salivate every time she was in the doctor's office. And this excessive salivation, a treatment after using some medical treatments or Botox, is to remove the salivary glands because of risks of things like aspiration, which can create pneumonia, which worst case scenario can lead to death. Not always, can lead to very bad pneumonia, can lead to hospitalizations, can lead to different side effects, but worst case scenario can lead to death. And this one time, doctors removed the salivary glands of a patient who didn't need the surgery and didn't need the surgery because the mother fooled them by putting this over the counter medication in her child's mouth to make the child salivate every time went into the doctor's office and convinced the doctors. Now, I don't know all the history. I don't know if they did try the medical treatments or didn't try the medical treatments. I don't know. I just know it led to that child having an unnecessary surgery that has led to side effects for the rest of her life, which she is now an adult and discusses about how she has to constantly clear her throat because she doesn't have enough saliva because she never had too much saliva. And now that her salivary glands are removed, she doesn't have enough saliva. So she constantly has a problem with her throat and having to constantly clear it. Some of you might know the story because it's part of the story of Gypsy Rose Blanchard. I personally don't follow a lot of medical stories because I've had enough in my lifetime. The point is, this is a there was this one time type of story because most of the time when salivary glands are removed for sialorrhea, this is not the case. It is typically done for medical reasons to prevent things like excessive salivation and aspiration, which could lead to death. But there was this one time that many people know about because of the notoriety of that case. So, what should be done? Because that was horrific. This person is now left with horrible side effects. She had, as a child, had an unnecessary surgery. What should be done? Should we now not listen to parents? If they come in and tell physicians about what's going on with their child, should we just not listen to them and wait till children can tell their stories themselves? But what about children that might never be able to communicate that? What do we do about the kids while they can't communicate for themselves? Or should we just not do the salivary gland surgery? Should we never remove any salivary glands? Should we do that? But what happens to those that are at risk of aspiration pneumonia and all that goes with it, potential hospitalization, long term side effects, or even death? But there's a risk because of this one time of it happening unnecessarily to somebody who got the surgery and didn't need it. What should we do because we know of this one time? How should we change our practice? I bring this up because in the discussions of gender-affirming care, I often hear the story, even in my comments, of, well, there was this one time. And I'm not ever dismissing this one time as long as they are accurate and proven. This one time is important. In medicine, we do find those stories of there was this one time very important. The only thing is that many times it's being presented to me this one time as a justification to not listen to parents or guardians or to completely eliminate gender affirming care. And yet we don't do that anywhere else in medicine. Munchausen's by proxy is probably one of the most dramatic and remarkable examples of, oh, well, there was this one time. There will always be this one time in medicine. There is not one area of medicine, there is not one treatment in medicine where there is not a story of there was this one time. There's always this one time where treatment failed. There was always this one time where somebody abused the system, whether it's a patient, family, or provider that abused the system. There's always a story of there was this one time where things weren't done correctly. Always. And yet I can't think of any other example besides gender affirming care where the solution to the stories of there was this one time that people's answers are, we'll just get rid of the treatment for everybody. There was this one time in medicine is important, as I mentioned. We use it. We know it's a learning tool. We dedicate time in most institutions to study that one time. We call it morbidity and mortality. We bring in the cases where something unexpected, unusual happens, where this one time happened, so that we can learn from it. What happened? What was going on? What was the decision making? What was different about this? What can we learn that we can take into the next time so this one time doesn't happen again? I don't dismiss when people bring to me this one time. I listen when people bring to me, there was this one time when this happened. I think they're important because they can help mold how to consider counseling patients. What are we forgetting to discuss with patients? What are we forgetting to educate patients on? But I don't find it a reason to eliminate an entire treatment. Let me give you a specific example. I had somebody, and I have to be honest, I don't know if this is factual or not. I didn't go looking to see if this story is true or not, but we'll use it as an example. Somebody came to me and said, oh, there once was this parent who forced her child to have a medical transition because said the child could not wear, I don't remember, something unless they transitioned to identify as a girl. They couldn't wear, I don't know if it was a color or a piece of clothing or something. I don't remember exactly what, but something along. There was this one time. I don't know if that's true or not, but let's just assume it's true. That story doesn't tell me that we should eliminate all gender affirming care. That story tells me a few things. They were educating families on the difference between gender identity, gender expression, and biological sex. That means that we need to counsel the patients on making sure that they know that they can express themselves in any way, regardless of how they identify. Meaning they don't need to transition in order to wear a certain clothing or dress a certain way or have their hair or whatever, express themselves in any way they want. And it also tells me that we need to make sure that we offer counseling of support to parents and guardians, because oftentimes they're afraid of how their child, their loved one is going to be treated. And that's what comes up to me when I hear this story. And so those are the things that come to mind. That's how we take this one time. And of course, I'm just taking what this person says to me. I'd want to hear a lot more details and hear a lot more of that story, but that's a little bit that comes to me. And so that's where this one time can teach us a lot, but it doesn't mean we stop listening to parents. It doesn't mean that we eliminate a therapy. I think the thing that gets me is so many times this one time when it comes to parents, like that story that I just mentioned, when I have spent time with hundreds of parents and guardians for over a decade, and I don't see parents just like, woo, whatever. I see parents thinking and guardians thinking carefully and loving on their kids and considering with great care about how best to support their child, of questioning how to support their children, of what is the best way? How do I know if it's a phase or not? How do I support them, but also make sure that the best decision is being made? Make sure that I help them understand the feelings that they're having. Make sure I help them understand the decisions that they're making. So the thing that gets me about all these stories of this one time is that those one times might be true, but it is ignoring what typically is occurring. It ignores the typical journey, the typical story. No two journeys are the same. But yet there's this belief of this narrative from that one time as if all parents are like, I don't even question it. I don't even think about it, whatever the kid wants. Or that parents are like, no, my kid needs to be on hormones today without a care in the world. When the most common thing is a parent saying, I want a live child, I want to support my child, and I have a lot of questions. I don't want to feel rushed. I want to make sure this is the best decision. But that is not the story we're hearing. We are so focused on that one time. That would be like as if saying every parent that goes into a pediatrician's office has Munchausen's by proxy because we heard about this one time of Gypsy Rose. That every parent that goes in concerned about their child's well-being, wow, they must have Munchausen's by proxy because of this one time. That must be what it's always like. If we just focused on that story and that story alone, that must be the story of all parents. But we don't do that because we can distinguish that that's this one time. And we don't lose sight that that's not the typical story of most parents and guardians. But yet when we talk about gender-affirming care and their families, maybe because most people don't know what it's typically like. So they just hang on to the story of that one time and they use it as a generalization for everyone. But it's not. As I mentioned some weeks ago, the narrative is important. And it's important to notice that when somebody is talking about that one time, that typically means that's not the general story. Find out what the general story is, what the typical journey is. Yes, no two stories are alike, but it doesn't change the fact that most of the time, parents and guardians take under careful consideration what the options are. They're working in conjunction with physicians, other healthcare providers, therapists. There are multiple professionals that are putting their heads together with the patient, with the child to make decisions. These are not stories of this one time. That is why all the major medical professional organizations support gender-affirming care, because they know what the evidence supports. And yes, even the CAST report supported providing gender-affirming care for some patients. That's right. I'm going to say it again. The CAST report supported providing gender-affirming care for some patients. It did not support taking it away for all patients. So although there is an importance in knowing and learning from this one time, what is more important is that we make decisions based on the greater good, what is statistically significant, what is evidence-based, and what is based on the majority and the most common of what does occur. Because that is what matters. And quite honestly, you would want the same.